Geneanne? Do you want to come and learn how to do your portable oxygen machine? You know what this is for, don't you?
I'm Connell. I have a daughter with PH. Her name is Geneanne and she's 15 years old.
Make sure it's pushed on. Yeah, good girl. Open that. And can you remember how many litres do you have?
2.
Right, so what do you do? Is that okay?
Yeah.
Good.
Geneanne was born with Down syndrome and she had a hole in her heart, which is a VSD, ventricular septal defect is what they call it, which is between the 2 pumping chambers of your heart, so basically her blood goes the wrong way.
When Geneanne was 5 years old, her mum started to notice some alarming symptoms that Geneanne had never displayed before.
She suffered breathlessness, blue tinges round her mouth, blue fingernails and blue toenails, a lot of chest infections and really bad colds. Where we'd have just had a cold, she could have been in hospital just for having a cold because it turned into chest infections.
Other symptoms included fatigue and fainting episodes in cold weather. Geneanne was initially diagnosed with asthma, but the treatment she was prescribed didn't seem to be working, forcing the doctors to reconsider.
We had to do several journeys to different hospitals. She had what they call a cardiac catheter to check to see how high the levels were, and that's when it was totally confirmed then that she did have pulmonary hypertension.
Pulmonary hypertension, or PH, is a rare but life-threatening disease that restricts the flow of oxygen from the lungs. Left untreated, a patient has a life expectancy of approximately 2 years. But even with treatment, the outlook for patients can be bleak.
Basically, they said when Geneanne was first diagnosed that if she made it to her teens that she would have done really well. So when she hit 13, we had the big party, the disco, everybody from all over the country came, limousine, she had champagne, we did it all. Because we just don't know when she's 18, will she be here to celebrate her 18th birthday? We really just don't know.
Anti-jacket. Oh, that's me.
Basically, we try to cope, do the best we can, try to not pretend that she's not got pulmonary hypertension, but we don't want it to take over like our lives as well as Geneanne's life. We try to keep things as normal as you possibly can. When we do talk about it, we tend not to talk about it in front of the kids. And when we really do need a break, because let me assure you, you will need a break when it gets you down and you're seeing it every day, we've got quite a good family that will come and take them. They'll actually take both of them for a night, 2 nights, whatever we feel like we need. I don't know, you just sort of get on with it. Life's basically what you're dealt and you've got to get on with it.
That's Sam. That data will pay up.
Thanks to recent advances in medical understanding and treatments, many patients can now experience a much higher quality of life than previously thought possible. However, there is still some way to go before experts fully understand the causes of PH and are able to formulate drugs to combat the disease or even prevent it from developing.